We've had a good day, good morning so far, and we've had a lot of interesting talk and a lot of interesting ideas being presented, some of which we think we've understood and some of which we're still trying to comprehend or figure out what in the world it was that they said, or it piqued our interest and we want to know more. So if you have a question for any of our panelists here, please raise your hand and we'll get started. And I see one in the back. Wait, real quick.
I'd like to ask Dr. Anderson, in the raw data that she presented in regard to uninsured in the state of Wyoming, I'm wondering how that was counted, number one, but more importantly, did the count discriminate between the undocumented individual, many of whom I'll see in my practice, vis-a-vis discriminating and counting only those who are documented, if you will. We know that the ACA does not cover the undocumented, and to me that's one of the greatest challenges in the United States, much less Wyoming. And obviously it'll be a stepwise progression to eventual coverage, but I'm curious, how was that statistic counted, and did they differentiate between documented and undocumented?
They don't discriminate between documented and undocumented workers, and those numbers are from the let's see, I'm trying to remember which of the alphabet soup, the Bureau of Economic Analysis. There are so many, Bureau of Labor Statistics and Economic Analysis. And that is from a specific portion of the Bureau of Census, the economic population survey that is done every month. And so they do, and a lot of it is extrapolated out from a sample. So there is no differentiation between them, and you're right, there is no provision in the ACA. In fact, there's very specific language in the ACA that disallows or undocumented immigrants, or whatever you might call them, from being covered by any of the provisions, including the expansion of Medicaid, or to participate in the exchanges. So that's a very good question.
I was wondering if you had any idea what the language would have to be from Congress to make corporations not a human citizen.
The question is the language Congress would need to include so that corporations would not be considered citizens or individuals under law. You know, I would imagine that there would be a way to define the legal parameters. I mean, corporations don't have any constitutional right. I mean, there's no provision in the U.S. Constitution that says a corporation is an individual under law, which suggests to me that Congress could, define very specifically the parameters. And I understand it from listening to various forums when Citizens United first came down, that there are various situations under law that constitutions are treated as individuals, and I remember that from my high school civics class. But there are also other situations where they are not treated as individuals. And again, I've heard lawyers debating that. And so I would imagine there is language that could be written to exempt an entity, because the First Amendment, the supposition of it as individuals have rights. But I don't know that, I'm out on a limb here because I don't know all of the law regarding corporations.
So the Roberts Court decisions didn't specifically make that forever for corporations?
No. What the Roberts Court did was, in Citizens United, reiterate that campaign spending is free speech, and that in other instances, the law, through both statutory and constitutional interpretation, had defined corporations as individuals. Therefore, if individuals have a right to free speech, then these individuals. Okay, that was kind of the language, boiling down. I think Citizens United was like a 180-page decision. But when I was in graduate school and we were taking constitutional law, we very often read the original cases, because you go back into the 18th and 19th century and early 20th century, the original case was 20 pages long. Now the excerpts. I've been working on clearing a number of court cases for a class next spring, and I'm trying to boil 200-page decisions down to 20 pages. It's not easy, but that's an aside. I don't think that the court, again, like I said in the presentation, the court's unlikely to reverse itself quickly, but I think that Congress, if it could come to a decision, would be able to write that, but I'm not sure exactly what the language would be.
So there is some hope.
I always think, I'm an optimist, okay? The glass is never half empty. I do believe that we have a political process that allows for open discussion and making more reasonable decisions in the future.
I came to this meeting and was looking for what I consider to be academic bias. Happily, I can say that I didn't hear any, and for that I'm very pleasantly surprised. I'm just curious whether you all have any unofficial tally, if you will, or any unofficial thoughts about the bias, the political bias amongst the faculty vis the students at the University of Wyoming. I know from where I came, the bias is decidedly unilateral. Do you have any thoughts? It's more of a silly question than anything else, but I'm just curious about what are your intuitions, if you will?
I teach American culture, and I teach American studies, and so I'm sort of, for better or for worse, sort of implicated in the culture that I'm looking at. And I really don't talk politics with my students, and I don't know what their political leanings are. And it's hard for me to sort of parse out where they stand on particular issues. And I don't think that's part of my job, because I'm not talking about politics. But one thing I have noticed in the last several years that maybe I'll get back to later on, because I've been trying to think of how all three talks fit together, and I want to talk about that in a little bit. But one of the things I've noticed in the last several years is the feeling not just of disengagement, but kind of disempowerment from the students. Like I would take any political passion in a class, as long as it was passion. But I just don't see passionate students so much these days. I see students who feel like they're being acted upon instead of acting themselves on behalf of their own education. And that's what concerns me. I don't care what their politics are. I just want them to feel passionate about something. And so I'm searching around for things that they can feel invested in. Some of them get involved in social justice. Some of them get involved in sports. But I just see a lot of people who aren't involved in anything. And so investment in the culture in some way is what I'm after more than politics.
I see two different types of students in political science. One, I see the students in political science 1000, American and Wyoming government, who are there for the same reason I took freshman biology. And that is, there's a check-off sheet that you have to meet this requirement, whatever. And those students are, they vary from the very disinterested who, I know they're on their they're texting. They don't think I can see that. But there's some that maybe they're not a political science major, but they try, they put an interest, they want to learn. But I also see, because I teach upper division classes, students who are very passionate about politics and the political system, who, they have interest and they know, they've been in enough classes with one another. They know which ones in the room are Republicans and which ones are Democrats, and they're very respectful of each other. I've only had, in the last 15 years, I bet I've had one student that I really had to pull aside and say, your passion's good, but your behavior isn't. You tell them that, treat each other respectfully and we'll all have a good time, and they do. Now, part of your question was a question of liberal bias on the faculty, and that's something that comes up all the time. Quite frankly, there are, and I won't name them, but there are maybe a handful of people on the faculty that if I have concerns about a student, I will warn the student that this person has a bias, and they're not all liberal. I mean, and I will admit the ones that really stand out, I warn students, and there are a couple very liberal. But I think most of the faculty, we approach this from the angle of we want you to think critically. Okay, we want you to be able to take a situation, look at it from all sides, and make a decision. And then, you can have your own opinion. I don't care what your opinion is, as long as you've considered all sides of it. And I think that is really the predominant approach that the faculty has. I mean, the faculty, we're all college-educated people, and we know that college-educated people participate in politics more than people who have not. And we are, all politically active, or at least voters. But that doesn't mean that our vote has to have any influence on what we say. I've had students criticize me in the same class evaluation that I was too hard on the president and I was too easy on the president. Same class. Students have come at me from both sides. And when I get that, I said, well, I did my job. And I think that is a predominant opinion on the faculty, of those of us who deal with issues that have political. I mean, as best I know, there's not a Republican or Democratic solution to a quadratic equation. So, if there is, I missed it.
Pete, do you have a question?
Thank you, Paul. I'd like to follow up with Ann, if I could, on the projected costs of the ACA.
So the question was, why are there so many wide ranges of numbers for estimates of everything? How many people would be in the exchange, all the way to how much it would cost to expand Medicaid for the state? Well, part of that is that, and I was having this conversation, I think, with Paul last night, that one of the interesting things is we're trying to predict future behavior of humans, and we're not very predictable. So when I come to the ending slide of any economic forecast presentation, I say I think Wyoming employment will be 5.25% in 6 months, and I have no idea, honestly, if it's really going to be that. But I have models that I use to try to help me say what I think what it's going to be, and I hope that I use assumptions when I'm doing the modeling that are reasonably reflective of how we behave. But not only are we kind of unpredictable on an individual basis, but when you start putting us in groups, we're even more unpredictable. And so part of the reason why there's such big ranges is that we want to be careful about how we say things. So I don't want to say it's going to cost you $53 million to expand Medicaid, because I have no idea if that's really the right number. That is a possible number that it could cost you. But if we enrolled more people, and if the expansion was more expensive because costs rose at this rate rather than that rate, then you would end up with a $350 million bill. And there's a big difference there. And I want to make sure that you know that it's possible that you could end up with either one of those things. So the numbers, the ranges are there, as far as I'm concerned, when they're presented by anybody doing these studies, the Millman folks, Kaiser Family Foundation, the RAND, the study that I did, we're trying to provide some guideposts for people so they can see what's possible and what's likely to happen. But we certainly don't want anybody making a decision based on a number that we're saying authoritatively that's going to happen, because we just don't know that that's what's going to happen. We want to make sure there's a range in there that people can at least look at the trend and rely on the trend at the very least. So I don't know if that answers your question, but that explains that big range. Every time I write a specific report for anybody, I always try to say, this is the low end, this is the low end, and this is the conservative end, which is the high end, which usually means this is the, you're gonna have to put away some money for this. And so So, but you're just trying to present the most likely outcomes, but you can't say which one in that range is the outcome, so.
I understand that, but with that larger range, you could almost say that about a study. A question, I guess, for Eric. In your extensive travels and work abroad, have you noticed in the last 25 years any change in the perception of this country abroad?
Not a bit. Is there a change in perception of the United States over the last 25 years? Sure there is. Boy, how to typify it? The world is a big place. And it's hard to typify such a general thing from a series of examples. But I would say in general that for us teaching about American culture, the Bush years were not happy years. It was tough outside the United States explaining what was going on. And I eagerly undertook that because I do believe that, even though he wasn't my favorite president of all time, he was the president. I'm implicated in what's going on, so it's my responsibility to respond to what other people say about our culture. And when you teach American studies outside the US, a lot of times you end up answering questions that have to do with American foreign policy, American economic might, and American popular culture. These are the three ways in which the United States, I think, influences the world the most. And so I would go out and talk to people who were perfectly happy consuming American popular culture products, but were really resentful in a lot of cases of American foreign policy. And so negotiating a kind of cultural appetite against a political or ideological bill of goods, that's what has been very difficult. And tracking alongside that, I have to say this, is my kind of doppelganger, my companion inside the U.S. government, namely the cultural diplomacy people. The U.S. Information Agency and now the public diplomacy branch of the State Department. While America has become much more a complicated issue abroad in many different ways, there are so many countries that are becoming multicultural and they're looking to find out what we did and how we did it. There are all kinds of transnational movements that make looking at the United States now a really interesting adventure for a lot of people around the world. At the same time, the American government has disinvested in public diplomacy. Our diplomacy has become much more narrowly focused on foreign policy and military objectives and economic support. So with all that's going on, there's less of an infrastructure for anybody to rely on for knowledge about the United States, other than the kind of thing that I do. And so I feel more and more sort of on the front lines in explaining the dynamics of a country that continues to be a puzzlement for most people outside the United States. It's totally fascinating. It waxes and wanes in enthusiasm. It was great to be abroad in the first couple of years of Obama. Oh, Americans walked on water. Everybody wanted to know. So it kind of comes and goes, tracks with foreign policy more than I would like. But it's been the highlight of my career, just trying to negotiate cultural difference in a room with people who aren't invested in our culture the way we are.
One of the issues for the uninsured in our state is the fact that individual insurance is so expensive. And therefore people are unable to purchase insurance if they're not part of a company. In the work that you did and the work that was done for the state by these outside people, did anybody look at what the total cost of care is going to be for the state under the Affordable Care Act? Is it going to go up? Are individuals going to find out that their insurance, as some people have suggested, that their insurance costs are going to go up? as we put the new Band-Aids in and we start to pay for these other things?
Part of every one of those studies that have been done has been asked to try to quantify what the state outlays would be, and then in addition, what some of the benefits might be. And the benefits, as far as I've seen quantified, are even more all over the place, Senator Jorgensen, I'm sorry to say. as far as how big they really have, the variation is amazing. The benefits are numerously listed as there will be less reliance on other parts of state programs. There would be less need for, say, example, food assistance. And, you know, these are just people throwing out assumptions again, so that's why they're so highly variable. But there is part of the range of numbers that you see comes down to the fact that there are probably folks, and this happened in Utah, has had an exchange for some time. Massachusetts has the connector, which is another exchange. That was part of their reform. And they're run slightly differently, but they both have found that initially those people that come out of the woodwork, they drive costs way up because they are very, they have a lot of complex problems that have to be treated right away. And so they may have chronic illnesses that have never had any sort of treatment whatsoever, or they've only had emergency treatments of them. So those folks may drive costs up right away, but that might be offset by the cost shifting that is currently done when people go to emergency rooms. So there are all these moving parts that say there's going to be some increase in costs. There's going to be the cost of provision, in addition to the fact that costs of healthcare itself will go up for a little while. In Utah and Massachusetts, they found that the increase went up, it kind of leveled after a couple of years. Whether we're like Massachusetts or Utah is hard to say. We may be closer to Utah, but they both saw a leveling off, but the costs did start to come down over time, or at least they've been seeing that trend over the past year or so. So it's tremendously hard for anybody to say this is going to be a net win or a net loss at this point, because there are so many moving parts. But people have tried to look at what are some of the benefits, reducing cost shares, reducing other state programs that might be overutilized right now. And it's just really hard, again, as usual, to say what that quantifiable effect is going to be. But people have tried to at least enumerate them so people can think about them, the people who actually make decisions.
Let's say you were the owner of a private practice or in charge of the budget for a hospital, a small hospital. Just for the next 2 years, okay. Where am I going to need to spend more money? Where am I going to need to focus on versus where can I pull back?
Where would I go? I have no idea. It's okay for me to say that, I hope. Because I know that there's a meeting upcoming next week, I think it is, in Saratoga, of all the CFOs of the hospitals. And I think they're going to talk about this. What are we supposed to do over the next couple of years in the face of the fact that we do have this thing coming down the line on us? Is it going to have an impact on utilization of ERs? Should we then move to different things? Should there be more emphasis on getting a dialysis unit or some other kind of chronic treatment, things that our locums can use? But preventative care more. I think there is going to be a trend. One thing I will say, and I think this is actually extremely good no matter what you think of the healthcare reform law, is that I think more collaboration with other providers and hospitals to do more integrated approaches to provision of healthcare is going to become more likely, so that you don't have to go from doctor to doctor to doctor when you're diagnosed with or you have something wrong, and they each have to do the same set of tests over and over and over. That helps drive costs up immensely. So sharing of information, this medical home concept, I think that's one good thing that will come out of it no matter what. And I think hey, I have an answer. That's what I would do. It took me a while.
Can you repeat?
How did they pick the Hart Mountain location? Realized they were under some time constraint here. They had to pick it in a hurry. They had to pick a location where they didn't have to haggle. And in Wyoming, that would have been a whole bunch of haggling because the governor was not in favor of this. They had a whole bunch of Japanese and Japanese Americans assembling in transfer centers in California. There were many of them, 40 or so. And so where are they going to go? The answer is to federal land. And so the Bureau of Reclamation had the land available in Wyoming. A couple of them in Arizona were located next to Indian Native American reservations. And generally speaking, I don't know about Arkansas, but the other ones were located on land which the federal government actually had, in effect, control over, legal title to. So that's why they put it there. Now, why they picked that Bureau of Reclamation land over, what, the 49% of land in Wyoming that the federal government might be able to lay claim to, I'm not exactly sure. Probably it was next to a rail line, that's one thing. It was flat, that's another thing. There was water available because they were going to open up that irrigation district later on. So one of the first things they did when they got there was just dig a canal so that they could start to plant stuff. So yeah, I think that's how it got there. I think.
Who decided what Japanese families went to what internment camp?
Another good question, and I can't rightly answer that. I do know that the people that sorry, good question, which I need to repeat. How do we know who made the decision of who's going where? So which families ended up in which camps? My thought is that's probably a decision that was, well, it's obviously a decision that was made out on the West Coast, but just in the nature, the logistics of distributing people, the people who ended up in Hart Mountain started out in either Los Angeles or San Jose, with a very few of them coming from Washington State. So my thought is that it was much more efficient to bundle people up and send them off in batches from places. But as I was mentioning at the end of the talk, there's a lot of circulation back and forth. So there are many Japanese American families who spent time in two of these. Tule Lake and Hart Mountain had transfers back and forth. And so there was a kind of circulation among the 10. The two in Arkansas closed pretty fast, so there were 8, and so they circulated around some more. But that's a really good question, just a logistical question. How did they get there? That's a good question.
As a former business guy, when you're making a major investment, you A, do test markets, or B, you look at what had been done before. So my question to you is, do you get the feeling that anyone in government says, let's try this out? For example, you might say the Ryan Plan. If you like the Ryan Plan, go to Wyoming, put it in effect, see what the problems are, how much it costs, and then you won't have to guess at the cost. We'll have some data that says, this is what happens. Now that would be one way to do it, and the other way is the other way would be to do some really intensive studies of Massachusetts, which is a very similar plan, find out where the wheels came off the wagon, what we anticipate in year 1, 2, or 3. Do you ever hear of people suggesting, let's do this, breathe through our nose, and let's see let's get a good guess at what's going to happen to us?
You know, it's kind of interesting for the Medicaid expansion, they did look at what had happened when they had expanded Medicare as an example to see what might happen. Completely different populations, of course, but this is what they did. There was quite a bit of study of both the Utah and Massachusetts health exchanges, and those things seem to be fairly successful, although they are differently run. The Utah system is more along the lines of a defined benefit. So you get so much money, you go to the exchanges, have a good time. You, the business person, give your employee that money. Massachusetts is much more formal and run more administratively by the government. And there have been quite a few studies on those since they came online, but both of them were so recent when ACA was just starting that meaningful results have yet to be, I'd say, tallied out of them. But I do know that some of the simulations that we did, the way that you look at how people react to changes is look at how they've reacted to things before. But again, a lot of this policy, a lot of what was coming out of ACA that is at the state level, it is an immense piece of it, if you will. So the policy changes are really at the state level. A lot of the insurance changes as far as who gets covered until what age and pre-existing conditions and so on, those were national policies that were enacted and put in place earlier because they knew they'd be less complicated and the insurance companies had already agreed to them. The more difficult, complicated moving part stuff was almost all shifted to the states to do. And we have a conveniently located next to me a political scientist. Perhaps talk a bit about this.
There is an area of study within political science that focuses on what's called policy diffusion, and that is the extent to which policies that are adopted one place and are adopted elsewhere. One of the things that is emphasized quite a bit is that the states do provide a laboratory. As Ann mentioned, the Affordable Care Act drew upon the experiences of Massachusetts and Utah. The welfare reform that was adopted in 1996 drew on a number of different state innovations in welfare policy. The difference was something that Ann alluded to. There was more time after the adoption of the policy in the states on welfare reform to see what those effects were, to see what had worked and what had not. The Affordable Care Act didn't have enough post-reform implementation data to really give us as good an idea as we would like to have. I mean, as someone who would develop public policy, it would be wonderful to be like my friends in the natural sciences and say, okay, I'm going to have Massachusetts do this, I'm going to have South Dakota do this, I'm going to have Arizona do that, and we're going to see which of these three works best 10 years from now. But, it's a funny thing that we can't tell states what they're going to do, and so the best we can do is try to find something that is similar or has gotten in the fringes of what we do. But very often the emphasis for reform comes so quickly after what's done at the state that we don't get as good of information. Again, the natural scientists, I'm simplifying what they do tremendously, I realize. But in the laboratory you can control everything. You don't have to worry about a pandemic, what effect it has on the healthcare system. Because you introduce the pandemic into your samples as you want. And so it's one of the reasons why public policy decisions are so difficult to make as to what's going to work. Is we don't have a good laboratory, or we're trying to make the changes nationally so quickly that we don't have enough good data, as Ann said, and things like HCA.
What happened to all the people of Hart Mountain after the war? Were they allowed to go back?
What happened to the people at Hart Mountain after the war? Did they have anything to go back to?
Who paid for it?
And who paid for it? The federal government paid a little bit. They got them back there, wherever there was. You had to choose your own there. Once they got there, the period after the war for many families was worse than the period during the war because they didn't get the government support They didn't get the attention, but they also didn't, a lot of them didn't get their property back or their goods, and so they had to start over. And so one of the first decisions, I mean, word was coming back early about conditions and things, and so if you were a family, the first decision you would make is, are we going to go back to what used to be our truck farm near Los Angeles and try to start over, or are we going to go someplace else and start new? And I don't think for anybody it was terribly easy for years after the war. Most people did not stay in Wyoming. In fact, Wyoming was from the get-go pretty insistent that they not stay in Wyoming after the war. I think some people did anyway or migrated back to Wyoming, but as I said in my talk, this is really the start of the Japanese diaspora, and a lot of people decided that going back to an uncertain home in California wasn't going to be as satisfying as lighting out for the territories and going to Milwaukee or someplace like that. So it's just one existential crisis after another. You know, you get dislocated and put into a place in Wyoming, and you stay there for 2 years and try to make the best of it, or 3. And then after that's over, where's home? I haven't studied that so much among the families, but there's been good work done on that. What happened to families after World War II, and it's, for several years, it's not particularly pretty.
I can't quote you exactly, but the phenomenon where those who are in office are the ones that are most likely to be reelected. We know they have an advantage. But the fact that people always think of their own representative as praiseworthy, honest, a few other words we could use, and then always distrust the others. Has there been any study, further study on that, other than that seems to be the fact of why people don't change their minds when they are presented with the facts about their particular representatives?
Okay, the question refers to the high reelection rate of members of Congress and why this all comes about. There are many things that are reasons why congressmen are reelected. Pick up the newspaper, and how many times do you read a story about what Mike Enzi's doing, or John Barrasso, or Cynthia Lummis? And occasionally it's something critical, but mostly it's, what are they doing for Wyoming? That's the image we see. I had a student who many years ago was doing an internship in Malcolm Wallop's office, and he told me that his job was to get Malcolm Wallop's name into the papers favorably every day. And of course, this is the time they were sending faxes. We hadn't invented email yet. It was okay. So you send out press releases, and quite frankly, if you know what you're looking for, you can tell the difference, and it's very minor, between a newspaper that simply takes the press release out of an office and reprints it. Laramie Boomerang does that. And then, I'll read it the same day or the next day in the Casper Star, rewritten as a story from the AP. And it's, the language is pretty much the same. It's, in the AP reports it is, Senator or whoever said, blah, blah, blah. So, there's a lot of ability of the congressmen to get their names out there, their image out there very favorably. They have a campaign finance advantage that, contrary to a lot of the political action committees out there buying votes of congressmen with contributions, contributions generally tend to follow favorable voting records. There are some groups that will always invest in a Republican or always invest in a Democratic candidate in the race. But for the most part, interest groups, PACs look to who has voted for us. Whose behavior is one that we feel is in line with our values. And you don't have a record like that on a challenger, but you have a record like that on an incumbent. And so the challenger doesn't get as much money, they don't get as many TV advertisements, they drive across Wyoming rather than fly across Wyoming on campaign. All these things where money can make a difference. But then if you look at the national news media, what are the stories about Congress? It's all about the dysfunction We know that the people we're familiar with and we know the most about seem to be doing the good things. Okay, they vote like, you know, the population, the whole of the state would want. We've met them. You know, I've met all of our congressional delegations. They're all nice people. You know, they come to campus, they talk to students, they encourage civic engagement. I mean, they're great doing that. I mean, I've gotten to know Al Simpson over the last few years. But we, you know, I don't know a congressman in Massachusetts. I know their names. You know, the image that comes out of the news media of the dysfunction in Congress, I think drives that. You know, Congress can't get anything done. They can't agree on anything. You know, they go there with very strong opinions. You know, they feel they're representing their constituents, and that their job is to represent their constituents, and who have a different set of values than constituents in some other place. And so that, you know, that they're not going to give. That's where the lack of compromise comes in a lot of times.
Perhaps one more question before you draw to a close.
I've been kind of curious, as far as political donations. I found myself feeling, you know, kind of on the outs in Wyoming, even though I've lived here almost 40 years. And I find myself giving money to politicians elsewhere that do support my views, that are not supported here. And do you think that's going to change, you know, where now with email and the internet and awareness? I was just wondering, is that going to be a bigger thing where, you know, yeah, that person's not supporting you in your state, but they do vote the way you feel?
In this situation, you live in a state where, you know, you feel your contribution isn't going to make any difference. And so you want to give someplace else. And it could be, you know, it doesn't matter. I mean,
yeah, I mean, I'm sure
Cynthia Lemus is going to win. You know, I'll bet on that. I'll take any bet. You know, and so it doesn't matter Republican or Democrat.
Yeah,
you're not going to influence that race with a contribution. So yeah, I think there is, because the candidates have learned how to raise money. You know, I've talked to people who start getting, you know, in the conventions, okay, watching the convention, they would start getting appeals for money over email. You know, wasn't that a great speech by, now of course the person who's sending you, you know, this has all been timed to be after the speech was over and they're running a little late and the speech isn't actually over yet. But, so, I mean, but all this instantaneous communication, and you give online, you know, you can give United Way online, you can, you know, you can give the University of Wyoming online. Dave, make your pitch for you. For people to say, okay, I can't, it doesn't matter what happens here, but I can contribute to a candidate in Colorado or wherever. So I think it does change the way the candidate. You don't get the mail. It's made fundraising less expensive. Regardless of how your member votes, there are 218 or 217 other U.S. representatives who are going to make a decision that affects you. And so we are all affected by what they all do. I mean, so it's a rational contribution strategy to do that. It's just that most people don't think about it. You know, maybe the percentage of people who give to campaigns is extremely low. I mean, it's a single-digit percentage. I can't give you the exact number, but it's really, really, really low. But those people who want to give, like anything else, like any charity, if you want to give, you can find the way, and the internet has just made that a lot easier.
Eric, you want the last word?
I don't know if it's the last word, but I just wanted to thank you on behalf of a Saturday University newbie. This is the first time I've done this sort of thing. It's been wonderful to have the opportunity to talk with you and have you be so engaged with what we're doing. It's been a really wonderful conversation, and I think it's something that I know I want to do again. It's been very nice, and I thank you very much.
Ditto.
And we'll see you in March.